Hi everybody, my name's Kate Martin and I'm the Lived Experience and Engagement Lead for Wellcome's mental health programme. I'm really delighted to introduce our next set of speakers, James, Meghna, Veronica, Grace, Chantelle and Shuranjeet, who are going to really talk about positioning lived experience as a really crucial, vital form of expertise and knowledge needed within the mental health research system. I'm really looking forward to hearing what they have to say. They're going to be talking to us about some of the challenges, the opportunities, but most critically, their recommendations for people with lived experience and the wider research system to really make sure that lived experience expertise is embedded in all the work that we do. This is really critical for us at Wellcome. We are really committed to exploring what we're doing in our own practice in terms of working collaboratively alongside people with lived experience, but also being more mindful and thoughtful about how we can really encourage and support this in the work that we've done. So I'm delighted to introduce our next speakers to take forward this keynote.
Hi, my name is Shuranjeet Singh and I am a lived experience consultant working with the Wellcome Trust. The term lived experiences is becoming increasingly popular throughout mental health. From service provision and the development and deployment of research and policy, the mental health landscape is finally starting to engage with the importance of experiential knowledge and those who have directly experienced mental health challenges. This term and concept does not exist in isolation, but builds on decades of survivor and user activism across health and social care. Moving from patient advocacy to a world in which user knowledge is seen as equal and legitimate is not easy, but has been driven by many who have come before and will be sustained by those who come after us. Today, we'll be hearing about the importance of lived experiences and experiential knowledge in mental health research, not from myself, but from a fantastic team of lived experience advisors working with the Wellcome Trust. With the help of their insights and perspectives, we will consider three areas: the key challenges to centering lived experiences in mental health research, the key opportunities lived experiences can provide, and finally, some recommendations which I encourage everyone to reflect upon and potentially implement in your settings. I'm excited to be your host as we listen, learn, and reflect on this topic together. First, I invite the team to introduce themselves and reflect on the key obstacles to lived experience involvement in mental health research.
Hello, everyone. My name is Chantelle, and I'm based in Durban in South Africa. I'm a lived experience advisor for the Wellcome Trust. Quite recently in South Africa, we had a very visceral experience with the attitudes on medical experts towards civil society and people with lived experience. A ministerial advisory committee was established to advise the South African government on the rollout process of the COVID-19 vaccines and related issues. When asked by a journalist why there are no representatives from the non-communicable diseases groups who are directly and disproportionately affected by the disease, an academic on the committee stated, and I quote, "The Ministerial Advisory Committee is a body of scientific and medical experts who look at scientific aspects and not at sociological and anthropological and those kinds of issues. It is not really appropriate for them to be on this committee." This is an example that can directly be applied to the scenario of lived experience in mental health. It is unfortunate that scientists, researchers, academia, et al. Are so short-sighted as to think that their own bias can be included in research and does not make space for other people's biases or experiences that will add more value and insight to research. The voices of people living with mental illness or have experience with mental ill health, whether in caring positions or being cared for, have been undermined for hundreds of years. Yet we are in an era with the highest number of mental health issues identified in history. This just means that science has failed and rejected to include experience, expertise, and skills of those living with mental illness in a way that is constructive for them, for the research, and for the broader global community. Rejecting this very critical component in any kind of research should be deemed incomplete or lacking legitimacy. I will finish off with a quote by Dr. Mike Ryan at WHO. "Everything in the pandemic is about trust. Innovation is needed in behavioral science, on how we as communities and individuals understand epidemics and behave during them, process information, and advise, and how we build trust. That is as scientific as building vaccines. All of these points can be transferred into how we build science and a science community for mental health and well-being that is truly open, inclusive, and responsive to our varied expertise. Thank you.
Hi everyone, my name is Grace Gatera. I use she, her pronouns, and I'm a lived experience advisor working with the Wellcome mental health priority area. While there is power in sharing one's story and putting truth to power, young people and people with lived experience are often reduced to just their story. They are pigeonholed into this one category and are not afforded the ability to be flexible, versatile, and regularly their contributions are discounted because they are not seen as experts and fully knowledgeable. This is why it's important to listen to young people and not request them to perform their story anytime you need input from them. People with lived experience have a lot of contributions to make in every part of mental health research, access, and delivery. We are imbued with wisdom from our lived experience, and we are often eager to make a contribution past telling our stories. Listen to us. Thank you.
Hi, my name is Veronica Wanyee, a lived experience advisor from Nairobi, Kenya, working with Wellcome. It is important to acknowledge that historically, people living with mental illness have been dismissed as incapable of contributing meaningful work in the field of mental health. This is usually with the exception of the emotional labor of detailing their medical histories, and even then, this emotional labor may not be documented as work. Lived experience involves more than simply sharing our stories. By shaping, informing, and existing both within and beyond mental health theoretical discourse, advisors are able to provide invaluable perspectives. This insight serves as an asset and acts as the backbone of meaningful mental health work by expanding understanding within the field. As such, we cannot continue to disregard lived experience as non-work. Rather, we should recognize and identify lived experience expertise as a valid and impactful task. And like all other forms of employment and consultancy, this necessitates fair and equitable pay, even where other research experts are not remunerated. The unspoken expectation that this work might be unpaid is disempowering. It contributes to the notion that lived experience is less valuable than other forms of expertise and directly reinforces the mental health crisis to lack of income pipeline that leaves people with lived experience dependent on their loved ones.
Hi, I'm James. I'm also a lived experience advisor with the Wellcome Trust. Another one of the challenges that I and others recognise with utilising lived experience is the issue of how to quantify and involve the expertise that those with lived experience can bring. No collaboration is without its challenges, and research is no exception to this. However, by combating this challenge, we can help to bridge the gap between theory and practice. It is not 100% clear how to best involve consumers with services and treatments without making them the subject of that particular research. However, consumer-led involvement would ideally be the best way to do this. Those with lived experience can bring forth new knowledge and ideas capable of creating and legitimizing new interests, whilst also reshaping our understanding of existing practices and mental health issues. Close collaboration with researchers would also be an effective form of involving lived experience. This collaboration should occur in all aspects of the research process, including identification of the research question, the research design, process, analysis, and dissemination of findings. Having said this, there are of course various limitations of involvement, and we are still trying to understand where these limitations are and how they can be overcome. However, effective utilisation of lived experience can also be realised outside of the immediate research arena. Networks can be established between users and researchers to create possibilities of exchange, support joint reflections of work, and undertaking joint research. There can be also consumer commentary on applications or consumer peer review of public research. With this in mind, the possibilities around lived experience involvement may seem daunting, but through discussion and reflection, we can turn this from an idea into reality.
While there may be some challenging obstacles to fully embedding lived experiences within mental health research, there are many, many amazing opportunities that those with lived experiences can provide and share within this developing landscape. Now, our advisors are going to be speaking about some of the amazing opportunities that lived experience involvement can bring not only to the research that we're doing, to the advisors themselves, to the wider team, but importantly, to the world more widely.
Traditionally, mental health work has centered the views of psychologists, psychiatrists, and clinicians. However, current trends emphasize the importance of interdisciplinarity. Lived experience involvement includes advisors from diverse educational and professional backgrounds, each bringing a unique wealth of information and skills to the table. These advisors exist at the cross-section between individual academic or non-academic expertise within their chosen field and an intrinsic knowledge and interest in mental health. For example, an economist and a sociologist with lived experience may have distinct, yet equally important views of the mental health care systems with which they interact. Providing a platform where these views intermingle allows for the building of an intersystemic understanding of mental health care and widens the scope of research and projects in the field by bringing to light new and innovative ideas which may have otherwise been overlooked. Utilizing lived experience provides an interesting opportunity to harness the interdisciplinary knowledge of advisors and experts to create a more rounded understanding of mental health as a whole. This in turn paves the path to a more inclusive future in the field. This cannot be achieved without having advisors and collaborators at the heart of this shift in knowledge.
It is also crucial to build the research skills of lived experience experts to challenge existing inequalities in research, which may make work harder and less accessible for lived experience collaborators. Certain expectations or stereotypes might lead both the researcher and lived experience expert to think that researchers may have fears and concerns about working with people who've had mental health issues and who are inexperienced in research. Likewise, service users may be intimidated by the idea of research and by the status of research professionals. If researchers begin collaboration with this kind of view, and if they think that they alone are the expert, then the prospect of collaboration is considerably weakened. To combat this, it is important that an open and flexible approach is adopted when working with each other. It may also be useful to encourage those with lived experience to familiarize themselves with research methodologies and terminology, or could possibly produce a glossary for non-researchers and host workshops teaching the nature and conduct of research. So, although that many may not have had formal training on methodologies and terminologies of research, those who are involved in research will either have at least basic research skills, or if they don't, they will definitely be incredibly eager to learn as the work progresses, or in one go via workshop or supported background reading. We want to learn, and in doing so, we know that we can make a difference. This is a point I can't stress enough. Those with lived experiences are exceptionally eager to make a difference and give back, to improve the services they have been through, and to develop our understanding of mental health issues. Researchers will gain lifelong skills by working with lived experience collaborators, and it is a matter of equity that these developments are mutual and flow both ways.
Hello everyone, I'm Meghna Khatwani. I'm a lived experience advisor from New Delhi, India, and I want to talk a bit about community knowledge. So lived experience can come from a number of different people that bring with them the knowledge bases and experiences from a multitude of backgrounds. As a general norm, only certain clinical or academic forms of knowledge are valued and validated in the field of mental health. These forms of knowledge, due to their inaccessibility in terms of academic language, concepts, and research resources, can actually tend towards being restrictive and even exclusive for a certain social strata and group of people. To combat this, and since there is no one-size-fits-all approach to mental health, it's important to work within the unique context of the people the research aims to work for. Centering the lived experience of individuals across countries, communities, religion, and various other backgrounds provides the opportunity to tap into previously unknown or uncharted territory and transform mental health and mental health solutions into more sustainable, accessible, applicable, and relatable forms of knowledge. Community-based knowledge emerges from the context that the person lives and grows in, is reflected in their practices, mindsets, and sensibilities. Therefore, utilizing community-based knowledge in shaping research not only shows a respect for and understanding of the different contexts each person with lived experience comes from, but also helps create and deliver mental health resources and concepts that actually work.
Thank you to our lived experience advisors for speaking about the various opportunities that exist within the proper embedding of people with lived experiences in mental health research. To close off for today, our advisors are going to be sharing with you key recommendations which we can reflect and potentially act upon with ourselves, within our work, and how we engage with the wider world.
If we then accept that young people and people with lived experience are knowledgeable and that they have expertise in mental health from their lived experience, then there must be an acknowledgement of the value of the contributions that they bring to your work. The level of wealth that people with lived experience bring to the work and to this sector must be matched by acknowledgement, remuneration, and opportunities. If we are experts, use us well, pay us well, and hire us more. Thank you.
One of the biggest worries that someone with lived experience has when working with researchers is that they will be restricted to tokenistic involvement. Examples of this type of involvement can include only involving the lived experience advisor in part of the project, exclusively asking for advice on how to recruit participants, or limiting their advice to extremely trivial matters. Having said this, these types of involvement might still be extremely useful, and they should therefore still occur, but involvement should not be limited to these types of roles. For many reasons, it is crucial instead to place lived experience at the center of research. It can help bridge the gap between theory and experience for a more holistic and ultimately more useful approach to research. It is important for addressing context-related specificities, for devising policies that actually work and ultimately produce a greater impact in practice. If lived experience is not used in a central role when devising and conducting research, mental health policies can be applied where it is inappropriate to do so. Simple tokenistic involvement will also harm the relationship between the lived experience advisor and researchers, thus making current and future collaboration even harder. We need to break this rationalist fallacy that theories and ideas alone are enough. Instead, those with lived experience should be included as much as possible and from as early as possible.
I want to leave everyone with a few questions that we should all be asking ourselves. What does research look like for you? I personally think of a very sanitized clinic with men in white coats milling about doing stuff of great importance. And that really begets my next question. Why is this image so one-dimensional? Where are the different people from different age groups, genders, communities, and cultures? Is this image something I've created on my own? Or have I been taught to believe that this is just how things are? The first step towards changing something is questioning beliefs we may have held for a long time and not even known about it. Only when we see what our sanitized images are missing can we actually begin to bridge the gaps in research and knowledge.
Introducing lived experience expertise into mental health research and projects does not invalidate current forms of work and knowledge. Placing advisors as decision makers and providing spaces within which their perspectives, skills, and knowledge are incorporated allows us to work in more inclusive, authentic, and sustainable ways. This adds meaning to the explorations we undertake and builds into rather than away from the work that already exists. It's important to recognize that we are all on a learning journey and that this requires constant and honest reflection and dialogue so that we can improve. By working together and ensuring that there is value placed on both lived experience as well as other forms of knowledge, we can begin to make significant progress in developing radically innovative mental health care systems.
My colleagues have mentioned so many poignant points, and I wanted to add some of my own. So while people with lived experience advocate together, sharing similar sentiments to create change, we are not a homogeneous group of people. We are people with individual expertise, with skills, experiences, connections, passions, and powers that is legitimate and can only but enhance the work of any scientific effort. The scientific and academic community often lack the imagination required to ensure the correct people are consulted, included, and developed. An example I have here is of a major funder who made funding available for youth mental health projects. They decided to change their criteria to ensure young people and people with lived experience are involved in and lead the project. As a reviewer of the funding process, I was astounded at one, how organizations just didn't follow the brief, as they didn't deem it an important requirement. And two, included young people and people with lived experience as an afterthought. And three, how difficult it was for some to share the institutional power with young people and people with lived experience. It certainly made me realize the lost opportunities of involvement that were overlooked in this process. Research on mental health and in mental health should always involve people with lived experience in many different ways. Unlike the traditional process of consulting them from the hypothetical and physical hospital bed, but to expand the idea of inclusion into endless opportunities. Young people and people with lived experience can be involved in so many ways, from co-designing the funding applications, to co-designing strategies for the project, to co-creating the intervention and program, to assisting in administrative tasks, to leading the project rollout, to facilitating elements in the project, to connect with the community work, to design social media personalities and multimedia content, to collecting data, to analyzing data, to reporting and analyze data, to feedback to clients of the study, to involvement or leading, monitoring and evaluation, to dissemination findings, and. So many ways to ensure that young people and people with lived experience are involved in the research in a meaningful way. Give people agency and legitimacy of their knowledge, expertise, and skills, and they will serve as an asset to the organization, the research, the project, and the community. Our imagination in research is powerful, and lived experiences have a potential to fire up this power. Thank you.
So today we've been incredibly lucky to hear from a group of mental health activists, advocates, and agitators to share their insights and their expertise with us. Lived experiences and the concept it denotes is the key for understanding a future in which we can ensure that nobody is held back by mental health challenges. The journey will not be easy, but with constant reflection paired with action, we will be able to transform mental health research and society more widely. I would like to say a huge thank you to our speakers for helping us to understand the obstacles and opportunities, as well as the recommendations for lived experiences in mental health research. The least we can do is give their points and their recommendations thorough consideration as to our contexts, and support those who want to take this work further in a move towards equalizing and democratizing knowledge production and policy processes. Thank you to our audience, those who have listened, those who have learnt, those who will take action into their respective communities. We are all learning together, and we look forward to a future in which we can all reimagine the future of mental health research together in a conscientious, compassionate, and collective way. Thank you all.
I'm sure you'll all join me in saying a massive thank you to James, Meghna, Veronica, Shuranjeet, Grace, and Chantelle for that really thought-provoking and inspiring keynote presentation. Listening to them talk, I guess I was left with lots of points that I kind of I was struck by, and that certainly I'll continue to reflect on in my own practice and in my work going forward. So first of all, critically, I think we all need to be urged to see lived experiences more than stories, that lived experience expertise might be formed and shaped through the experiences we've all lived through, but that becomes a form of knowledge and expertise and insight that is critical in the mental health research system from beginning to end. And I really took that challenge from Chantelle and others that really kind of made us think through all the different stages we need to involve and engage people with lived experience. And I think as Chantelle ended, and I guess that struck me, because I think what we know now, our practice will evolve and change in the future, and that continual reflection on what can we do, how more can we progress, I think is really critical. I was also struck by, and what I kind of was left thinking was, that it's not just what we can support and enable people with lived experience to learn or to develop, to be involved in mental health science and research. But actually, critically, it's also that what others can unlearn, that all of us need to sort of be reflective and think through what is it we're doing that is advancing this work, but what things may we need to unlearn to create more space for lived experience, knowledge and expertise in the work that we do. How can we challenge or undo some of the exclusionary processes that have just been embedded and built in to our systems, and to really think through why certain forms of expertise may have been privileged over others, and that, you know, certainly the thing I take from working alongside my lived experience colleagues and advisors and consultants is that they are colleagues that work alongside me like any other member of our team. And I think the more that we can position lived experience expertise as embedded within our work, I think the more value that will bring and the more change that we will all create. I think it's also really apt that the recommendations ended with a series of reflections or questions that will certainly sit in my mind and help me reflect on how we progress this work. I think there is no perfect, that our work to involve people with lived experience is constantly evolving, constantly changing. I'm certainly really keen that as Wellcome in our mental health programme, that we continue that learning, in public, to really share what's going well and what the challenges are, so that we can learn as a community alongside. So I look forward to continuing to learn with my lived experience colleagues, as well as our partners across the mental health field, to really think together how we can advance the involvement of people with lived experience. And lastly, I think it was really vital that we ended the recommendations actually with a series of reflections and questions. I don't think there's any such thing as perfect involvement. There's no clear end point. This is a continually evolving and changing series of practices and processes that we're all working within, to really make sure that we're centering the expertise of people with lived experience. I certainly am continually learning. I really value being able to learn alongside my colleagues, my lived experience advisors and consultants who work with us across our programme, and of course continuing to learn with colleagues and partners and expertise from across the field of mental health science. So thank you for listening today, and I look forward to hearing more contributions as the conference progresses.